Last week, we spoke about some of the more common but difficult feelings that women go through when they're pregnant, giving birth, and early motherhood. Well, today we're going to talk a bit about when those feelings become prolonged, chronic, more extreme, when they turn into diagnosable perinatal mental health conditions. Perinatal depression covers antenatal depression, so before your baby is born, and postnatal depression, which is after your baby is born. And the symptoms of each are generally very similar, and very similar to general depression: lowness, sadness, worthlessness, hopelessness, a lack of energy, struggling to do anything in particular. But what happens with perinatal depression is you may also start to experience indifference or hostile feelings towards your partner or your baby, and a real struggling to bond either with your growing bump or with your baby that's just being born. And with that can come some real feelings of guilt and that you're not doing things right, you're not feeling the way that you should be feeling. And this can also then manifest into quite frightening thoughts, things like thinking about harming your baby. Now, some of these symptoms can be confused with what we call the baby blues, and we talked about the baby blues a little bit last week, which are those really common feelings that women have in the couple of weeks after giving birth, the low mood, the extra emotions. The difference between the baby blues and postnatal depression is that the baby blues only generally last about 2 weeks after you've given birth. Postnatal depression will last much longer. So if you're noticing those symptoms lasting longer than 2 weeks, or they start more than 2 weeks after you've given birth, you could be looking at postnatal depression. And postnatal depression can actually happen. It can start any time within the first year after you giving birth. Perinatal anxiety covers antenatal and postnatal anxiety, OCD, and postpartum PTSD. So diagnosable perinatal anxiety is a more chronic, so a longer and a more constant and more extreme sense of anxiety for a woman. So a constant sense of nervousness, tension, dread, picking up compulsive behaviours, things that we do to try and make ourselves feel like we can avoid something bad from happening. A lot of intrusive thoughts come with perinatal anxiety. So worrying that there's something wrong with your child, or worrying that you're going to perhaps slip down the stairs whilst you're holding them, or actually that you are going to do something to hurt them. So they're intrusive thoughts, images that flash into your mind. And with this can come quite protective behaviours. So you may be constantly checking on your baby. Are they still breathing? Really worrying about the kind of tiniest little thing that's wrong with their body. Maybe they've got a little bit of nappy rash, and really focusing, there's something really wrong with them. I need to get them to the doctor. And also a protectiveness in terms of not trusting anybody else to look after your child. So if you are feeling like you don't want to leave them with their grandparents, or you don't want anybody else even to hold them, you don't trust anybody else to look after your child. And postpartum PTSD generally comes from a traumatic birth. So if you've had a really difficult traumatic birth experience, you might experience things like flashbacks, nightmares, and then lots of anxious feelings afterwards. And the most serious of the perinatal mental health conditions is postpartum psychosis. So this is a very serious condition, but it is also rare. So it only occurs in about 1 in 1,000 births. But what we're looking at here is a mix of depression, anxiety, and psychosis. So rapid mood swings, going from being absolutely elated, mania, down to crashing lows, a depression, not being able to concentrate, feeling really disorientated, not being able to sleep, and then mixed into that, the psychotic symptoms: hallucinations, delusions, hearing voices, believing things to be true that actually aren't.